Welcome, everyone. Thank you so much for joining us this morning. My name is Thea Keith Lucas, and I'm the coordinator of Radius, which is a program for ethical reflection here in the MIT community and in our wider community. This program, Poverty Amidst Pandemic, came out of a conversation I had with my very good colleague, Trish Weinman. Excuse me. We were talking how this experience for us really heightens two realities. One is that we are deeply interconnected, that our health depends on widespread participation and compliance, and our daily lives depend on the work of others who put themselves at greater risk than we experience ourselves. And at the same time, there's a second reality that we are so isolated from one another. That this physical isolation just amplifies the stratification in our society, the bubbles we live in, so that I could go through my day and only see my neighbors or other professionals who, like me, are able to hop on a Zoom call and connect to each other. I think that our ethical decisions are really rooted in how wide a lens we're willing to take. Who are we able to see who is impacted by our choices? So we are really excited today to welcome some friends from the Poor People's Campaign, a national call for moral revival. Are really going to help us widen our lens and see the experience of pandemic more fully. We're joined this morning by, first I want to introduce my colleague at Radius, Shannon Schmidt, who is always great at asking me questions that challenge my thinking. And she is also going to support those of you who are our attendees in getting your questions into the conversation. Would you say hello, Shannon?
Hi, everyone. Like Thea said, I'll be helping with the Q&A today and looking forward to reading your questions. So to access the Q&A, you can ask questions at any point during the event. You'll just go down to the bottom of this window, find the button labeled Q&A, and you can submit your questions from there. So we'll be taking a look at those toward the end of the event. So excited to read them.
Thank you so much for joining us, Shannon. I'd like to take a moment for our panelists to introduce themselves. We're so honored to have three leaders from the Poor People's Campaign with us this morning. Let's begin. Shailly Gupta Barnes, would you tell us a little bit about your work?
Yes, good morning, Thea, and thank you for having us all here today. My name is Shailly Gupta Barnes. I'm the Policy Director of the Poor People's Campaign, a national call for moral revival, and the Charon Center, which is one of the national convening organizations of the campaign. In my work in the policy area of the campaign, we've put out several different reports, including the Souls of Poor Folk Moral Audit, as well as the Poor People's Moral Budget. And now we're working on a policy agenda and priorities that draw from the needs and demands of 140 million people who are poor, low income in this country. And that's actually where our policy work begins, with what we need, with what those 140 million people need, and then how do we build the power to make that possible.
Thank you so much. And Charon Hribar, would you introduce yourself?
Sure. Hi, everybody. My name's Charon Hribar, and I work with Shailly at the Charon Center for Religion, Rights, and Social Justice, which is housed at Union Theological Seminary, as the Director of Cultural Strategies and one of the conveners. of the Poor People's Campaign. I'm also the co-director of Ethnomusicology and Movement Arts for the Poor People's Campaign, a national call for moral revival. But today I think the hat I'm wearing is a little more on the statewide work and local work in New York City. I'm part of the coordinating committee for the New York State Poor People's Campaign and on the regional committee in New York City.
Thank you so much, Sharon. And Savina Martin.
Yes, hi. Thank you for inviting me here. I'm from Boston, Massachusetts. I've been a part of the Poverty Initiative Project as a poverty scholar at Union Theological Seminary since around, I guess, 2010, maybe 2006, somewhere around there. But and also, I'm one of the statewide coordinators for the Massachusetts Poor People's Campaign, a national call for moral revival, as well as coming out of the National Union of the Homeless. Thank you for having me.
Thank you so much. We're really looking forward to diving in to these questions with all of you. There's one more part to our introductions. We have a video from the Poor People's Campaign to help everyone get a sense of the great work that you're doing. So just going to switch to that.
A powerful new movement is rising across America. From the Mississippi Delta to the Apache stronghold, from the homeless encampments of Washington to the coal fields of West Virginia. We are the 140 million poor and low-wealth people in this country, and we are building the Poor People's Campaign, a national call for moral revival.
On June 20th, between the primaries and the general election, we will rise together for the mass Poor People's Assembly and Moral March on Washington, a digital justice gathering.
Our nation is at a historic crossroads. There are those who say big change isn't necessary or possible, that we are powerless to make our lives better.
But history teaches us that it is exactly in times like these that people from all walks of life must build a broad and deep movement from the bottom up.
On June 20th, we will come together to lift the voices and faces of poverty in the midst of pandemic for a massive, historic online gathering that will embolden us, strengthen us, and prepare us to fight for the kind of society we know we so badly need and deserve.
Rise with us. Visit june2020.org.
It is now my honor to welcome back to The Late Show the First Lady of the United States.
That's a powerful image of a diverse community coming together. I'm excited to hear how you're going to engage that work online. But I just want to begin, just to get us started. I'm curious for our panelists, what is one thing you hope we will learn as a nation from this experience of COVID-19?
That's a really good question to ask us all right now, because one thing that's been revealed is that the inequities, there are inequities and longstanding problems that brought us to this point where the wealthiest country in the world has become the global epicenter of the pandemic. And our hope is that we understand together that we can address those problems, those longstanding problems. And if we do, that's the real answer to the COVID-19 crisis we are currently in. Those historic injustices in healthcare, in housing, and jobs, the dismantling of a social welfare system and disinvestment in our people. Also, we can really accommodate the accumulation and concentration of wealth and power in very few hands. That's what has set the stage for this virus to wreak the havoc that it has, where we don't have enough hospitals, where we don't have enough savings or incomes to withstand this lockdown, where we just don't have systems in place to be able to take care of ourselves. And so what we need is the flip side of that. We need universal health care, we need living wages, we need guaranteed incomes. We need to direct the wealth and resources of this country, including the personnel that we have, to make the equipment that we need and to move produce that's going to waste right now, millions and millions of tons of produce, move that to people's homes and tables and kitchens. And the thing is that we can do this. This is all possible, but we aren't. And this isn't because the resources don't exist. They do. We've seen them being released. We've seen the capacity being released to ensure that banks and corporations and the very, very wealthy are able to make it through this crisis. But the rest of us have been left more or less on our own. And so that's where the resources need to be turned to. So I think one of the most important lessons that we hope people learn from this is that, the longstanding problems that brought us to this point can be resolved, but we need to turn the attention of this country towards them to address this pandemic.
I guess I can jump in. Yeah, I think that's, building on Shailly's points of, we have the resources. And so, why is it that we can't actually address those? I think questions of the political will then come up. And right now, I really hope that we're learning that we can't continue to play these left and right politics, or Republican versus Democrat, or urban versus rural, which I think are still, unfortunately, kind of coming out in some of the, the ways that different folks in Congress and state governments are bantering with one another. We know, right now for people, the mass majority of folks are in the same boat. The Poor People's Campaign has talked about, like, since before this pandemic hit, there are 140 million people that are poor and low income in this country. And we would say, there's so many more of us that are one paycheck away, one healthcare crisis away, one emergency away. And we're in that moment, right? We're in that emergency. And so there are millions of more people that are joining those ranks. And we have to be able to respond to the reality that we're facing and not get caught up in the politics of it. And, the continual desire to divide us, to not, meet the demands that we know that we can actually meet. And just one quick example of that, here in New York State, we recently came together with our movement family in Kentucky to make a solidarity statement after Senator Mitch McConnell and Governor Cuomo were both using their political platforms to, continue this, Republican versus Democrat politics, instead of coming to the table with real solutions to the problems, our communities are urgently facing. Senator McConnell made the remarks that states should declare bankruptcy rather than seeking federal aid. And then Governor Cuomo, responded and was saying, that states like Kentucky are actually the ones living off the money that, states like New York are generating. And so while they're bantering about who are the givers and takers, and trying to, pit Republican and Democrat against one another, we're saying, this isn't about that. This is a time where we have to see that there's tremendous wealth that's still being made by a very few amount of people, even in the midst of this crisis, and that masses of more people are becoming poor. And that really, like, we have to be able to secure, things for our communities as more people are losing jobs, they're losing their health care, right? We're losing housing as a result. And in this, you also have, state governments that are then, like New York, actually passing austerity budgets. And this isn't the time for that. We actually have to think about how do we come together and utilize, the real resources that exist when we know we can, automatically generate trillions of dollars from the Fed. Like, these resources exist. How are we actually directing them? And that's what we're coming together across our states, across our communities in the Poor People's Campaign to actually demand and make that the priority.
Yeah, absolutely. So I'll jump in as well, lifting the courageous men and women and entire families in all of our 40 states, and even the extended family members of those of us who have laid our bodies on the line for the past several years, and even beyond that, prior to that, being arrested and in the midst of having their own healthcare crisis. And one of the most disturbing things and profound that I never thought that I'd see on the flip side of the quote unquote American dream, the American nightmare is being so close to the ground of the stench of death and dying. I mean, over the last month, I have literally lost so many friends and family. We just buried the matriarch, our grandmother who was in a nursing home, you know, and the calls from members of the Poor People's Campaign who are experiencing death as we speak and organize. So the deep appreciation of the demands that are coming out of this campaign are critical en masse for everybody, for all of us to continue to reach out, to come into this campaign and push these interlocking injustices forward and demand the change, in particular around housing and healthcare. It's real. We're seeing it unfolding. We are the living proof. The Poor People's Campaign is the living proof of tilling the soil, and we're seeing it unveil. So we implore people to come in and help us rise together.
Thank you so much, Savina. And I'm sorry to hear of the loss in your family, and also feel such admiration for that sense you have that together we can rise up from the grief and the loss of this moment for so many people. I'm wondering if you guys can tell us a little bit more about how the Poor People's Campaign works. How are you responding to the COVID-19 pandemic, and how has this situation changed your work?
So before I explain some of the numbers that we talk about, I just wanted to share, and Charon and Savina reference this as well, that the campaign, we're a national campaign, but we're organized in 43 states across the country. And each state has a coordinating committee and is connected to local work and organizing. And so we're a grassroots campaign that's, we're a national campaign that's grounded in the movement and organizing, across these 43 states. And we organize that work around 5 systemic injustices. We call them the interlocking injustices of systemic racism, poverty, militarism, ecological devastation, and this false narrative of extreme kind of religious nationalism that often pits us against each other and blames the poor for their poverty or blames people for the wrongs that they're facing rather than looking to systemic injustices. And, our work is really grounded in this idea of being able to bring millions and millions of people together who have been historically divided. If it's the power of people acting and taking action together that can change this country and change, realize the demands that we've been making. And so just to talk a little bit about the 140 million that we reference so much, this is a number that comes out of our research and work on and looking at who is poor in this country. And if you see on your screen, we calculated that there are 140 million people who are poor or low income. And all that means is, there are about 40 million people living below the official poverty line, and another 95 to 100 million people who are living just above that poverty line. And so any emergency, as we were saying earlier, Sharon was saying, any emergency, including a health crisis, including the loss of a job or a paycheck even, could push you under. And so we include that entire population because the poverty line itself is so meager. It's such a low estimate of what it takes to actually meet your needs in this country. And that 140 million people, as you can see here, includes more than half of our children. It includes 39 million children. It includes 21 million elders. And the racial breakdown is really startling. Typically, if you look at just the poverty line, the poverty rate for Black and Latino folks is between 20 and 30%. But when you look at the broader range, we're looking at 60% of Black people in this country, or 26 million people, are poor or low income. 64%, or 38 million, not Hispanic or Latinx people. About 40%, or 8 million Asian people. more than half, or nearly 60% of Native and Indigenous people. And then 1 out of every 3, sorry, that the 33% is another category. 1 out of every 3, or 66 million white people are poor or low income in this country. And so numerically, white people actually account for the largest number of people who are poor and struggling in this country. And then 72, and they must join forces. They must come together with the 72 million poor people of color who are also struggling. There's another way to look at these numbers, so you could see the broad, the different, how these different injustices come together and what they look like. And so it's, 60 million people working for less than $15 an hour, or less than a living wage, in fact. 32 million people who don't have health insurance, but it's actually closer to 87 million people who are either uninsured or underinsured, which has made a big difference in this particular crisis we're all in. There are 23 million families, so we can multiply the 23 million figure that's on the slide by a factor of 3 or 4, who have a net worth of 0 or less, who have no savings with which they can draw on. They actually owe more than they own. Before this crisis, there were 14 million families who couldn't afford water. And there were about 8 to 11 million people who are homeless or on the brink of homelessness. And the response to COVID-19, that number of the people who are homeless was dramatically underreported. They used a 500,000 figure and basically left out 10 million people in their estimates and therefore their response. There are millions of families who are exposed to lead poisoning and other toxins in their water. And there are 20 veterans who commit suicide every day. This was all before this pandemic. And so this is what the 140 million faces every day. And if we go to the, what's happened since this pandemic, and when we take a closer look at the legislative response to it, we can see that millions more have been kind of added to those numbers. So the numbers on this slide indicate who was left out of the COVID-19 response, legislative response. And some of these numbers kind of, the highlighted numbers indicate new numbers of people who we think it's important to lift up right now. So the 72 million who are already in medical debt and could face more medical debt because treatment of this virus is not covered by the legislation. We mentioned that 14 million households can't currently afford water, but there are actually over 100 million people who have water only because their states and local governments have issued temporary moratoriums on water shutoffs. Those moratoriums are going to be lifted at some point, and there's no mechanism in place to ensure that they have access to water. There are 33 million current SNAP recipients who have to rely on $1.40 allocations for their meals. That's what their food stamps cover, $1.40, and that allocation was not increased. And in fact, there are 700,000 people who need to prove that they're working to get those food stamps. And as soon as those work requirements are reinstated in this economy that's lost 30 to 40 million jobs, they risk losing those food stamps. The legislation also left out, the entire population of undocumented immigrants. There are 5 million children who are citizens and 4 million immigrants who are taxpayers who didn't receive the stimulus payments, 4 million undocumented immigrants. Obviously, the people who are incarcerated and in detention centers were left out. It's appalling that all of our healthcare workers, 16.8 million healthcare workers, who are on the front line still without mandated emergency OSHA protections. The healthcare failures in the legislation include these closures of rural hospitals have been ongoing. And so this is just, this is the kind of gaps we're seeing. And in our assessment, this isn't an accident. This is because the orientation of our policymakers is not towards those people who are struggling in this crisis. And so our work right now is to reach out to everyone that we know, every contact we have on the ground, everyone we're in touch with, to bring them into this campaign. We've moved everything online, but this means phone banking to tens of thousands of people. And we're doing this both to reach out to people and make a connection in a time that's very lonely and scary for many of us, especially when we don't have networks or community institutions to rely on. But also that connection it is important for people to know that they are important. They've been abandoned. They don't have what we need right now. We don't have what we need right now. But we need to remind people that they are important to this campaign. We need to hear what they're facing and to share that with as many people as possible, and to tell the real stories of what's going on right now, why this response hasn't been enough, and what more can be done. And I wanted to share just a couple of stories that we've been hearing lately. One is from Mary Jane Shanklin, a woman out in Kansas who lives and works on a farm with her husband and father-in-law. They have one doctor in their entire county, and they expect they'll lose that doctor when the number of cases in their county increases, and that doctor will have to move to the next county after the beds in that county are filled to help with treatment. Their closest hospital is 30 minutes away, driving 70 miles an hour. They live in a food desert, and many farmers, Mary Jane is telling us, are in debt and struggling and scared because they don't know what they're going to do if and when this crisis hits their county. And last week she connected with Polly Henry, who's a healthcare worker in New York, who is angry and frustrated and crying about the needless loss of life she's seeing in her hospital. One morning she took the temperature of 90 patients who, without any protective equipment, without any paid leave, and she's crying out, she is not going to die silently so others can get rich right now. These are the people who are part of this campaign and their stories, and we will continue to lift them up. We shared Polly and Mary Jane Shanklin's stories. They joined a call that we had with members of Congress and through our social media and mass meetings that are ongoing, and it's through them that we're going to build the power to change the direction of this country.
Thank you, Shailly. Sharon, Savina,
Sure.
anything you'd like to add?
Yeah, I could. Or Savina, do you want to go first? Oh. Okay. Yeah, I think just building on, what Shailly said, and earlier, Savina, you made a comment about, we've been tilling the soil, I think is a really appropriate, way to think about where we are right now. I don't know that it's so much that we're changing the way that we're doing our work, but seeing how what we've been doing has really prepared us for this moment and is making it, all the more relevant for more people. And so I think, we're really trying to use this moment to help frame and continue to build and be able to bring in more people that are kind of waking up in this moment, and having, the committees across the country that Shailly mentioned, to be able to connect with people and reach out to people. And, I think, as again, Savina said earlier, this is work we've been doing for a long time, even, as we hear things like mutual aid networks. Our folks in our campaign have been doing that kind of work, but we talk about it a little bit differently sometimes. A mentor of mine, Willie Baptist, will say, we have to walk on two legs. And so part of a lot of the work we do working as poor and working people, we are working to meet our immediate needs. And at the same time, we have to be politicizing that work and calling out the contradictions about why in a society that has, enough housing for everybody, are there still people that are unhoused? Or, why is it that, we're having water shutoffs when, Nestle gets to bottle water for a few $100s a year in Lake Michigan? So these are things we've always been doing. And so as we hear the calls for, more people to be, running food pantries or calling for rent strikes or calling for moratoriums on water shutoffs, that's where our people are, that's where we've been. And so, what we're doing then is helping to have people question and think about why are we here in the first place? And we talk about, the two main things that we try to do in the campaign are shifting the narrative of, why are we poor, and being able to show that the immense wealth that exists, and also building the unity and power of poor and dispossessed people across all kind of differences that we've mentioned and divisions, right? And so again, just one example from New York State, I think of how we've been trying to do that in this moment, is lifting up a lot of, the organizations and networks in our campaign in New York State that are on the ground. And we've started a digital campaign that's lifting up projects of survival, is how we talk about this kind of work, right? That is both meeting needs and, calling to question, why these problems exist, and bringing people into the work through that. And so, across the state, anyone from, some of our folks in Cuba, New York, which is a very small rural area that's been, having to run food pantries for a long time, which, were originally set up as emergency food pantries, but people, because they're not making enough money, are already dependent on those food pantries, right? Because jobs aren't paying enough. And now they're operating at 160%, with the role of the pandemic. And so, being able to share, like, what has that community been doing for a long time, and why is it, even more relevant now, and being able to get more people to know about this. Or in Rochester, New York, and Savina could speak more around some of the National Union of the Homeless organizing, but one of the chapters is in New York State, the Rochester Homeless Union. In this moment has been able to, move over 100 folks that were unhoused into empty hotels that were, not being utilized. And while moving them in during this time when we're telling people that they have to shelter in place, and people don't have a place to shelter in, we're calling out that contradiction of why didn't they have a place in the first place? And there's these buildings that are lying empty, right? That they were closed and no one was living there in the first place. And it's not enough just for this moment to house folks, but they need permanent housing. Like, we have enough housing that everyone should have housing in this country, right? And so being able to not just meet people's immediate needs, but also show why we can do this all the time, right? And so that's the work of the campaign in this moment, is to be able to do both of those things, I think.
Yeah, thanks so much, Sharon. So MIT is no stranger to the National Union of the Homeless. When we were organizing a few decades back, Mel King, who everyone knows, Mel King in Massachusetts, who was over the Department of Planning and Urban and Planning Development, when the National Union of the Homeless nationally was taking over abandoned housing to call the plight of homelessness to attention, Mel King so graciously gave myself and about 5 other women a free acquisition course so that we could, turn that abandoned home into a place for homeless women. Closer to now, just like Sharon was saying, the Poor People's Campaign, we entered into the national call for moral revival once COVID hit, because everyone that we were always on the ground. So everyone throughout the states in small pockets hit the ground running in their fronts of struggles and knew exactly what to do. Here in Boston, some of our folks started helping to feed the school children because school had let out, and mothers and fathers depended on the school lunching to help supplement the food. And so to this day, activist Monica Cannon Grant supports the Poor People's Campaign, but some of our moms started helping her feed. I think she's feeding something like 1,700 people a week or something, or a day. I mean, it's a huge, huge number. And so that helped out. And some of our students, 6th grade students in the Poor People's Campaign, they need art supplies, right? Because they want to make some, posters and plackets for our digital march online. And the Poor People's Campaign is going to help in Massachusetts donate art supplies, make some drop-offs to the kids. So all across the country, these are the types of things we're doing within our fronts of struggles, whether it's in the student movement, the housing movement, the homeless movement, and on and on. Healthcare, right? We've hit the ground running and tried to, and we shouldn't, right? In the midst of abundance, when this country has all the right resources for us to live, thrive, and survive, we have to do that, right? The people, and also witness a great atrocity going against our humanity, and breaking that Declaration of Human Rights. So because we shouldn't have to go through what we're going through.
Thank you all very much. I want to encourage our attendees, make use of the Q&A button there on your screen. We'd love to hear your questions and invite our panelists to answer it so that we can meet your needs, answer your curiosity this morning. Um, do we have any questions to respond to now?
Yeah, we had a couple people writing in just asking about sharing the data slides and some of these statistics after the event. So just confirmation from the panelists that we can get these out to folks. Yeah.
Yes, yes, sure. We actually have I can send the resource page that we have at poorpeoplescampaign.org. We have a few fact sheets up there, including this one on who is left out of COVID-19. The COVID-19 response. And I would also encourage people to look at the cultural resources we have up there. As you know, Savina was saying, we've moved everything online for this gathering in June, and there are many ways that people can participate, and we're building towards that, whether it's through you know, these virtual art builds and making banners and, you know, moving things to you know, to show our unity, to show our power together, you know, that even in this crisis or through this crisis, despite it or because of it, we're continuing to come together. So we can definitely share all of that.
Great. We have another question coming in. So this person is asking, saying, I may have missed it. Are there disparities in the data between rural America and places like where we are in Boston? And could someone speak to those disparities?
If I could maybe ask a clarifying question, do they mean the COVID-19 data or just kind of overall poverty statistics?
So since they didn't specify, and just given the nature of the event, maybe speaking specifically to COVID, oh, they said either or both. So your choice.
So, you know, from what we're hearing, we have we formed recently this public health advisory committee to the campaign. And so we have public health experts who are looking at the information that's out there right now and informing us that the data that's available is lacking in many different ways. And so even though, you know, one thing that we're seeing already on the ground is that obviously the big cities like New York City or, you know, out west, they became these hotspots for the virus because of crowded conditions, because of inequality, historic inequality that, you know, bred the conditions for the pandemic to spread as it did. And we also know that because of the historic inequities in healthcare and income and, you know, and racial inequities, that what's going to happen in the South, especially in rural counties, is going to be worse. And so we're kind of bracing for that. But we haven't seen data yet that kind of empirically shows that disparity quite. It's anecdotal, and this is one of the demands that we're making, that the data that is gathered, at least, you know, on who's being infected, who's contracting the virus, and then who's dying from it, is, you know, broken up by race, gender, and income, so we can see that, but then also geography. So, and we know that, you know, especially in the South, there are particular concerns about what this virus is going to look like, given the you know, ongoing closure of rural hospitals in the South, and the lack of the expansion of Medicaid across 9 of the 14 states that didn't expand Medicaid are in the South. And so that's a big problem.
Can I just add one thing? Yeah, I think the thinking about the disparities in data is important, and I want to add that though, as we approach that and are able to break the numbers down, we also try to look at it as a whole, as we've been talking about and Shailly was mentioning, you know, and you know, not seeing the kind of empirical data versus the experiential data in opposition to one another, right? But that really through the campaign, especially because we have so many people on the ground in all of these places, like why that really helps to see the picture and make the kind of call for the large demands that isn't like pitting the rural and urban against one another. And, you know, if you look at any of the resources on the Poor People's Campaign website, whether it's the Souls of Poor Folk audit or the Moral Budget, right? Like all of our data is in collaboration with the stories of folks, and really being able to draw out, what are the real experiences that people are seeing. And I think because the data is often missing in especially rural places, or we know like data is definitely missing in indigenous communities, all of these things, how important people's voices are, and being able to come together in this movement that help us to really show like the full picture of what's going on in these communities when we know that data is not there.
We have a question that came in for Savina. So Savina, will you please comment on the current COVID-19 situation in Chelsea, Mass?
Oh, right. Yeah. So I was just on a webinar not too long ago with Gladys Vegas. I just want to lift her name right now. She is on the ground in Chelsea, Massachusetts. I mean, it just equal to what Roxbury is going through with the high numbers. So we have Ron Allen Goodwin, who is one of the Poor People's Campaign in Massachusetts. He's one of our statewide labor organizers, and he's on the ground with Gladys Vegas as we speak, assisting and helping them out. I mean, it's the same qualitative death and dying, lack of resources, lack of adequate health care, testing, which is being worked out and worked on now because of our demanding. So yeah, I mean, Chelsea is still not, well, let me put it this way. It's a sample of what's happening in all of the poorest communities across the country, so, and we need a lot of help, just like everywhere else, right? One other last thing, if I can say, and I promised our regional coordinator I would talk about the volunteering. We're having a national phone bank volunteering effort that's happening, I think, starting tonight and tomorrow. There's going to be weekly trainings. And if you know of anyone, moms, dads, grandmas that want to help volunteer in the phone banking, we'd greatly appreciate it. And I can email this information out. I was trying to put it in the chat, but it won't let me. But anyway, I can mail that information out. Yeah, all hands on deck, right? All hands on deck. Chelsea is going through a lot. There's a couple of veterans homes out in Chelsea where veterans have been dying, and staff, just like around the country, right, has been diagnosed with COVID-19. I hope that helps in answering the questions.
Thank you so much, Savina. We will be glad to include those volunteer opportunities on our website, which is radius.mit.edu.
Yeah, and I can only imagine the kind of organizing challenges you guys must be facing when, in my own experience, so much of organizing places such an emphasis on person-to-person, face-to-face contact. So yeah, really glad to hear that you've still been able to find these creative ways to organize virtually. We've got a question that came in posed to the group, which reads, the US spends nearly $1 trillion for its military, which is why we have so little money for addressing social needs. Is the campaign thinking of challenging this great problem?
Yes. Yes, this is actually, when we say that it's actually central to our analysis of the injustice that we're facing, and then how we have to respond. And so we talk about militarism is one of the 5 injustices that we name, and it is both because this rampant military spending draws money, necessary resources away from poverty programs, anti-poverty programs. And we've seen how that's happened over time. Our moral budget, which is also online, shows that if we cut military spending significantly, including cutting the 800, or so bases that are around the world by more than half, and shifted those resources towards housing programs and other social welfare programs, and but if we did that alongside raising taxes on those who can afford to pay more, including the wealthy and corporations and Wall Street, And we started to make investments of resources and raised resources, started to spend money on the things that we need, we can address all of the injustices that are, that we face. And I just want to make the point that spending, drawing down the military budget is both, will both free up resources that we need to do this, but it's also the right and moral thing to do. We cannot respond to every issue in the world or every issue in this country with a militarized, violent, forceful response. And so it's actually, we need to take those excess resources that are in the military now and move them to where they ought to be. But we also have to challenge, the moral, the immorality of having a military as great as it does, and what that does, how that distorts, how it distorts our economy, how it distorts our society. And so, and the same thing with taxes, taxing people and corporations that ought to be taxed more is both because they have excess, that has to be moved in a different direction, is also the right thing to do, the right and moral thing to do.
Yeah, exactly. So for me, I see the lay of the land somewhat like the suffering, if you will, for an example, of the social cost of endless wars in this country. And COVID is reacting the same way, physically, spiritually, mentally, and emotionally, as being in a war would. I'm a United States Army veteran, it's very disturbing to see how this country reacts. Now, 45 is a bad general, right? He would be a very bad general sending out orders and misinformation. So the concern is the resources, both mental health resources need to be put into the community for the physicians that are impacted by, say, it with post-traumatic stress syndrome, and suicides that happen during the course of wars. And that's what we're seeing on the ground right now. One of our greatest supporters and allies is Dr. Phillip. He's been with the Poor People's Campaign since our 40-day campaign. And just so happens, he is an infectious disease physician at Boston Medical Center, one of the busiest emergency triads. And he's impacted, right? And he keeps the Poor People's Campaign, his campaign, noted and updated on whether or not the nurses and doctors are getting PPE. He was actually trying to organize some of the medical students and colleagues there. As a matter of fact, he started a medical brigade. And we were on the phone one night and he said, Savina, they're just not able to concentrate. So every day, every morning at 7:45, they decided to have a silent vigil on camera. Another creative way to help center and bring folks in. I mean, we know that our physicians, healthcare physicians, are impacted now, right, by this. And some of them across the country are involved in the Poor People's Campaign. So can you imagine our mothers, fathers, sisters, and brothers, and our Poor People's Campaign participants who are essential workers being impacted by COVID-19? And what are we going to do post COVID-19 to assure that these resources, like Shailly was saying, it's in it. We found it inside of, the whole budget. It's in there. We found it. So we've got to continue to keep demanding, just keep going and finding creative ways to make sure that those demands and policies are corrected.
Yeah.
Looks like we've got one more question that just came in. So this person writes, retirement plans of millions of workers have been greatly damaged by stock market losses in 401 and IRA plans, by layoffs and employer business failures. Do you see this group as pre-poverty? And are there ways your campaign can influence government support, unions, and other job-oriented groups and senior groups like AARP?
So might start to answer this question, then maybe Sharon and Savina can jump in. I think this is, this question really gets to why we talk about poor and low income people. The low income, we could talk about that kind of numerically, but it's more this reality that more and more people in this country don't have any form of safety net, whether that's a retirement fund or a pension fund that's been kind of decimated through a bankruptcy crisis at your state or local government. So there are many different ways that that millions of people who ought to be ought to have more economic security just don't. And one of the things we found when we were going through the legislation for this COVID response is that, currently there are about 61 million people who receive Social Security payments from the Social Security Trust Fund or trust that people have paid into, right? That should be secure resources. But one of the provisions of the legislation says that employers don't need to pay payroll tax. And what that means, they can defer payroll tax payments. Those payments are what go into that fund for Social Security, and they can defer them for this whole year. And even 2021, up to 2021 and 2022 is when they can start to kind of replenish those payments. And what that could, the other provision that's in the bill says that the Treasury Secretary can will replenish the Social Security Trust to the extent possible. So it's very possible that those 60 million people who receive Social Security benefits, if the Secretary of Treasury determines that fund can't be replenished, they would see lower payments from their Social Security, first their Social Security. And so, yes, I think we should think about the people who are seeing this decline, who thought that they had these kind of secure systems in place to take care of themselves in a retirement phase, that those may not be as secure as we think. And it's one of the reasons why, the demands of this campaign, we really say are universal. All of us need healthcare. All of us need systems that provide healthcare, whether or not we can afford that, that care. And that's the responsibility of the government to provide that care to its people. And there are many different systems that are failing right now, and they're failing the poor first. But many of us would see ourselves in the same position as the poor, as being economically insecure in a time of great need, because our government has failed us. And so to follow, we call the social leadership of the poor, and this campaign is not just for poor people today, it's for people who may be poor tomorrow. And so that's really the breadth of the campaign that we have in mind, and we hope everyone who sees that and can, this campaign is for all of us.
I just wanted to build on that and speak specifically to the question of the unions, and thinking about, the way that we've actually been partnering with a lot of the labor unions to come in with this campaign, especially as the reality that more and more unions are seeing that who is their constituency are folks that are poor and low income, right? I think one of the things that was very striking was in February, we had actually done a call for people to join us in June, and had a lot of the leaders of labor come. Sorry, children are home. And come and, and talk about why they were joining with us. And we had a leader from the flight attendants union that actually spoke out and was talking about how, flight attendants were having to, even this before the pandemic, I mean, this is going to be a whole new reality with what's happening, in the airline industry moving forward. But that flight attendants were having to sleep in their cars or to sleep in the airports because they couldn't actually afford, to make with what they were making to have a home of like a roof over their head, or even between trips, right? Like to be staying in actually hotels, and that wasn't being provided for by their jobs. And so they were speaking out and saying, like, we, the flight attendants union, like, we're with the Poor People's Campaign. And so, you know, in terms of moving labor to be thinking about this and thinking about even the retired, you know, folks and pensions, you know, I think that that's not going to be a stretch. Again, we're not talking about a marginal portion of the population when we're talking about building a Poor People's Campaign. We're saying this is the reality for a mass majority of people, and we can see how this moment is actually, you know, any kind of false divisions that existed in people's minds before, I think is coming to a real clarity of why this is so important in this moment. I know personally, just on the, you know, my parents worked in the steel industry and saw, you know, as steel declined and, you know, was devastated in this country, you know, they get a third of the pensions that they paid into. And so my parents, my dad has passed away now, but, you know, it's made a much more precarious situation in their old age. And this moment is not, you know, making us feel secure in any kind of way. And so figuring that out is definitely this movement is for all of us.
As we come up on 11:30, I'm wondering, just to finish out our time together, and I'm so grateful for the richness of information and experience you've all brought. But if folks who are seeing this today or watching the video later want to get more involved, what would that look like? What could we do now? What could we plan to do on June 20th? How can we get engaged with you?
So, so everyone should, you know, if you'd like to join this effort, if you know, see your interests kind of aligned with what we've been talking about today, if you can see yourself in this conversation anyway, we encourage you to visit the poorpeoplescampaign.org and sign up for our digital justice gathering on June 20th. This gathering is going to be broadcast, broadcast live and replayed and everything. And so we're really excited about the program that's going to be coming together. And in all of the work that we do, we really lift up the voices of those most impacted, as we've been saying. And so if people are able to join that, once you sign up for that, it automatically kind of connects you to the state committee, one of the 43 state committees. And so it's a one-step way to become connected to this campaign. And we really encourage everyone to get involved and to, you know, in the many ways that you can be involved, whether it's like Savina was saying, volunteering to deliver art equipment, phone banking, reaching out to your network, sharing things online. There are many, many different ways to get involved. We encourage everybody. You know, we want everybody in, nobody out in this campaign.
Yeah, as we always say, bring your talents, gifts. Both nationally and locally here in Massachusetts, we have a Poor People's Campaign Facebook page. We're always looking for folks to assist with our social media page. I mean, right now we really want to saturate the airways with all of the great artwork that comes from Charon and her folks. So we have tons of Twitter, Instagram, uploads that you can jump on and help us to get the word out about June 2020.
Yeah, and I'll just jump in lastly. I know we're running out of time here, but on May 20th, we're going to be doing a digital day of action using the culture of the Poor People's Campaign. I shared I don't know if people can actually copy that, but we can share it out later. A toolkit that we're doing, kind of music and art to go along with that day. But really the goal is to be using the images and music of the campaign to invite others to join us on June 20. So we're asking you not only to join us yourselves and sign up to June 20, but to ask, you know, as many people as you know that you think that this is a moment where we need to all come together, you know, please invite them as well to join us on June 2020, because we know that we can't actually meet the demands of this campaign and that are for all of us unless we all come together. And so we really do need everyone that is here to be with us on June 20 and to show the kind of strength that we are building in this campaign.
Thank you so much. I know we weren't able to address all of the questions that came in, but you're so generous with your time. I know that there's a lot of work to be done on the ground. So your willingness to take this time and invite us in, we just appreciate it greatly. Thank you all for being with us. I hope this inspires more questions and more people finding ways to get involved.
Thank you so much.
Thank you.
Thank you.
And thank you to all our attendees. We really appreciate your coming and your contributions of questions.
As we say in the Poor People's Campaign, forward together, not one step back.
That's that.
Fantastic. Yeah.
That's right.
It's in there. Forward together, and not
Not
one
one step
Not one step back.
Okay.
Thank you, Thea.